I want to thank you for taking the time to learn about the breast cancer screening recommendations supported by Berkshire Medical Center. After all, knowledge is the first step in prevention. Even the most conscientious efforts to prevent cancer, including lifestyle, diet, self-exam, can't guarantee that cancer won't occur. Some women, because of genetic makeup or risk factors, statistically are at a higher risk for developing breast cancer, even though they've done everything correctly. You should know that 75% of women who develop breast cancer have no known risk factors. That's not meant to frighten or create anxiety. It's meant to help you be mindful, remain vigilant, and listen to your body. So when we talk about trying to maintain breast health, that brings up the question of screening mammograms, when they should start and how frequently they should be performed. At Berkshire Medical Center, we follow the recommendations of many other national medical societies, including the National Cancer Institute, the American Cancer Society, and the American College of Radiology. Those guidelines suggest a first or baseline mammogram somewhere between the age of 35 and 40, and annual mammograms thereafter. If there's a maternal history of breast cancer, we recommend screening 10 years prior to the age at which mom was diagnosed. Other women have significant family history or genetic risk factors that may compel providers to recommend a different screening guideline, and that should be taken on an individual basis. You may have heard about the United States Preventive Service Task Force draft recommendations that came out in April of 2015. Those recommendations suggested that women start screening mammograms at age 50 and every other year thereafter if there was no significant risk of breast cancer or family history of breast cancer. At BMC, we think it's wiser and more prudent to start screening at age 40 and have annual mammograms thereafter. We've been taking care of breast disease at the Women's Imaging Center for over a decade, and believe me, mammography does save lives.